My name is Tara Leslie. Welcome to Part 3 of the Orientation to Pharm 523 and Pharm 533 series, PBL Roles, Responsibilities, and Process. By the end of this presentation, you should be able to explain the roles of the course coordinator, case facilitator, and students in the PBL process used in Pharm 523 and 533. Describe the learning activities and general timeline utilized for each topic within these courses to meet the learning objectives. Describe the additional team roles suggested for each course topic and the associated responsibilities. Prepare appropriately for the PBL learning activities planned for our first orientation session at Spring Institute, and prepare appropriately to participate in the team rules and roles discussion during Spring Institute. Let's get started with responsibilities of the facilitator, coordinator, and students. Problem-based learning was described to you in detail during the first orientation session. As you will recall, PBL is an active learning method that is both self-directed and reliant on teamwork. It is a student-centered approach where the responsibility for learning themselves and teaching others is placed with the students. Embracing this philosophy is very important for your success in this course and the success of the entire team. Some of the key advantages of PBL is that it helps students to learn how to address complex problems. It goes beyond just memorizing therapeutic facts because it helps develop skills to figure out what needs to be learned. It requires integrating knowledge and application of critical thinking and clinical judgment, which are essential for the complexity of modern clinical practice and to enhance lifelong learning. Instead of a traditional teacher that delivers the required content, PBL uses a tutor to facilitate learning. In the first orientation video, the characteristics of high-functioning teams was reviewed. Teams have norms or rules that regulate the behavior of individuals within the team. These rules are built upon common beliefs and expectations for appropriate behaviors and attitudes. Within this course and the PharmD program overall, it is expected that you will challenge the ideas of others with respect. In addition, you will be expected to provide and receive feedback in a constructive and supportive way. We all want the team to function at its best and for everyone to have the best opportunity to be successful. When receiving feedback from a peer or a course coordinator or a facilitator, remember, our goal is to improve knowledge, critical thinking, and the ability to make and support decisions. Please also keep this in mind when providing others with feedback. Roles refer to the expectations defining the appropriate behaviors for a specific position within the team. Within this orientation video, I will be providing you with some background information regarding the roles in Pharm 523 and 533. At one of the synchronous sessions during orientation week, you will have the opportunity to develop some team norms and rules as a collective. As previously mentioned, PBL uses a tutor to facilitate learning. The PBL tutor, in our case of Pharm 523 and 533, is the case facilitator. It is important to note the facilitator is not the primary information provider, or in other words, the facilitator does not teach students in the traditional sense of teaching. The facilitator does, however, have expertise in the topic content. He or she has developed or updated the learning content such as the lecture, readings, case, and case learning objectives. They have compiled a resource list to assist you in the learning activities. This is a great place to start, but you may need to do your own literature search as well. The facilitators enhance the learning of the students by sharing clinical pearls or personal experience. But as the PBL process is student-centered, it is important that they facilitate the learning and not direct the learning. You can expect the facilitator to monitor students to ensure they are on track with their learning and that content is of appropriate breadth and depth to encourage application of the information and possibly pose questions to help challenge learners. The course coordinator in Pharm 523 or 533 may be the case facilitator for select topics within their area of expertise. The course coordinator will be responsible for assessing participation in the course. For participation, students can expect to contribute to the team learning by completing their portion of the team workload on time and contributing to group discussion with an appropriate quantity and quality of online discussion posts. At 2 points during each course, the course coordinator will provide you with feedback regarding your performance within the PBL process. Topics include participation, self-directedness, team interactions, and analysis of the evidence with clinical judgment. The mid-course feedback provided after, say, Module 2 or 3 is meant to be formative to improve your learning. The end-of-course feedback is summative and contributes to your final grade in the course. A rubric will be used to guide the assessment and the feedback, and it will be made available to you. The course coordinator will also monitor team dynamics and team function, as well as the PBL process, and provide feedback or direction to the team if needed. Course assignments are also assessed by the course coordinator, as well as the final examination and the course grades. Students are expected to be the primary providers of the information associated with each topic's learning objectives. Active participation and evident engagement is key. Students are expected to complete the learning activities as scheduled, meet the deadlines set by the team, and demonstrate engagement with the team and the process. Some of the specific learning activities you will be expected to complete include watching the introductory lecture, completing the required pre-readings, and reviewing the case at the start of each topic. It's also very important to write quality content for the learning of yourself and your peers during a topic module. Finally, it is also so important to be an active contributor to the discussions. There will also be some very specific team roles that each student will take turns fulfilling, and we will discuss these a bit later. Let's now do an overview of the PBL activities. As discussed in the first orientation video, the PBL process begins with presentation of a patient case, activating prior knowledge by exploring the topic, identifying one's learning needs, learning and teaching each other new knowledge, followed by identifying and clarifying the drug therapy problems, applying the new knowledge, and then further elaborating and building depth of knowledge. Specifically, how this translates for each topic in Pharm 523 or 533, it's outlined in this table. As you can see, the middle column of this chart lists the days within a 2-week period that the activities will occur. Sarah and I will be providing you with some suggested deadlines for completion of each activity for each module. And then we will finalize the specific schedule during one of our synchronous sessions during Spring Institute. Students will first review the patient case posted by the case facilitator to explore the topic and activate prior knowledge. The student will review the introductory lecture, read the recommended pre-case readings, and complete the quiz. Generally, this is done within the first 2 days of the topic or the module. Then each student will create their own individual learning objectives, or LOs, as described in the second orientation video. After submitting your own LOs, the case facilitator will make his or her list of LOs available. Each LO will be assigned to a student or a pair of students. The assigned student or pair will create content to address the LO over the next several days. Once the individual LO content is posted, students will engage in an online discussion about each LO and its content. Engagement and participation in the online discussion boards is very important to the learning and teaching of each other. Around halfway through the topic, you are required to create a list of drug therapy problems for the patient case. From these, a collated list of DTPs will be created for the team to be the basis of developing your patient care plan. On approximately day 10 or 11, you will synthesize and apply your new knowledge by creating a patient care plan for the case. 2 to 3 students in the class will then post their care plan for all the class to see in e-class. After posting, elaboration of the new knowledge occurs through online discussion of the care plans and through the topic wrap-up activities. You may be wondering, What do I mean by creating learning objective content, or LO content? Each student will be assigned 1 to 2 of the case facilitator's LOs. Each student is expected to create a concise summary of information to address their assigned LO. This summary should not only be concise, but also be a synthesis of the data that goes beyond tertiary references such as lexicomp or RX files. It should include evidence from appropriate sources, including the primary literature. The content should go beyond just the answers, but also explain the why. As such, cut and paste from guidelines or online tertiary references is not adequate, nor is it appropriate. And as a reminder, your summary must be your own work. Plagiarism will not be tolerated. If you require clarity on the university's plagiarism policy, please refer to the Code of Student Behavior available on the U of A website. Be sure to include your name, the date, and all references for your content. Also, page numbers are often very helpful for you or your classmates who may choose to print the information. I encourage abbreviations whenever possible and appropriate, as it can help to limit your word count. Let's move on to team roles and responsibilities. It is an expectation of the Pharm 523 and 533 courses that all students are engaged and active participants in their learning and within the PBL process. In addition, there is an expectation that team members follow the rules that are set out by the team. There are also some additional roles for each topic or module that Sarah and I encourage you to consider. These roles will rotate to different students with each topic or module. We suggest you implement a team leader. Again, the team leader role would be a different student for each topic module within each course. Suggested responsibilities for the team leader would be to be a liaison for each topic module. This would entail initiating contact with the topic facilitator 1 to 2 weeks prior to the topic start date to introduce themselves and then act as a liaison between the topic facilitator and the team for any module issues or activity planning. The team leader would also be the chair for the group meetings, such as the synchronous wrap-up meeting. The leader is also responsible for collating the single list of drug therapy problems and notifying the facilitator that they are ready for review. A process monitor is also a helpful role. The process monitor would be a different student for each topic or module. And the process monitor's primary function is to encourage participation, monitor the group process, and to help ensure that there is adequate wrap-up. For encouraging participation, a process monitor might encourage team members to communicate that are not participating as much or to follow the process. A process monitor might also be responsible for initiating discussion if needed, or to moderate or redirect the discussion. For example, if there is little commentary on a specific subtopic, the process monitor could start a discussion thread here to spark conversation. Or if a subtopic discussion is starting to stray off topic, the process monitor could redirect the conversation. For wrap-up, the process monitor should ensure that any outstanding questions are answered, and if not, prompt team members to circle back. They can also assess the group process as a whole at the end of a module and connect with the course coordinator or team members if they have identified any suggestions for improvement. The role of the care plan leader must be filled by 2 or 3 students within each topic, depending on the size of the class. This role is not optional, but again would rotate. All students are expected to create a care plan based on the patient case for each module, even if they aren't a care plan leader. However, it's the care plan leaders that will post their care plan on eClass for team discussion. Now, what are our next steps as we prepare for our orientation synchronous meetings during Spring Institute? When we connect during Spring Institute, we will discuss building a team with high commitment, the expectations of team members, and team norms. In preparation, I encourage you to start thinking about this now. For example, what do you expect of your teammates? What can your teammates expect of you? What are the consequences if someone doesn't adhere to the team rules? And how will the team monitor and respond to non-adherence? During Spring Institute, we're going to engage in some of the learning activities you will be involved with in the PBL process for Pharm 523 and 533. To adequately prepare, please complete the following activities. Review the patient case and complete the introductory readings. Once you've done this and feel somewhat comfortable with the material, go ahead and complete the quiz. Then, create a list of personal learning objectives or personal LOs for the topic. Please apply the principles discussed in the previous orientation video to develop quality LOs, including selection of an appropriate verb for each. Once completed, please go to the section in E-class called Individual Learning Objectives and click on your name to open a Google Doc. Please cut and paste or type in your personal LOs here. To summarize, at the end of this video lecture, you should now be able to explain the roles of the course coordinator, case facilitator, and students in the PBL process for Pharm 523 and 533. You should be able to describe the learning activities and the general timeline for the learning activities in the course. You should be able to discuss some suggested team roles and associated responsibilities, and you should be ready to prepare for the PBL learning activities planned at Spring Institute. Thank you very much for your time, and I look forward to meeting you online at Spring Institute. Take care. Bye-bye.